Hello, welcome, and thanks for joining us to help choose home when care is needed, a podcast all about the benefits, value, and safety of receiving care and services in the one place that feels most comfortable, wherever it is that the person needing care calls home. I'm your host, Marilee Orsini, and I've been involved in healthcare at home since 1981. Before we meet today's guest, a brief thank you to our sponsors and partners, the National Association for Home Care and Hospice, Access, and Core Cubed. Today's episode is number 13 of Season 3. Our esteemed guest today is Dr. Stephen Landers, a certified family doctor and geriatrician who's president and CEO of the Visiting Nurse Association Health Group, the nation's second largest not-for-profit home health care organization, servicing New Jersey, Ohio, and Southeast Florida. Dr. Landers is a graduate of Case Western Reserve University School of Medicine and the Johns Hopkins University School of Hygiene and Public Health. Before he joined the VNA Health Group, Dr. Landers served as the director of the Center for Home Care and Community Rehabilitation and director of post-acute operations for the world-renowned Cleveland Clinic. In 2014, Dr. Landers received the New Jersey Biz 40 Under 40 Award, a recognition of New Jersey's most accomplished young businessmen and women. Please help me, won't you, and welcome Dr. Stephen Landers to Help Choose Home. Well, I just want to say what a pleasure it is to talk to you. I always learn something new, and you always have wonderful knowledge to impart. So thank you for joining me today.
Thank you.
And where are you today? I know that you have operations in New Jersey and Ohio, and I might have missed some states, but so where are you physically located today?
I'm actually in our headquarter office in central New Jersey, and it's kind of remarkable that I'm in an office because we've not been doing a lot of our work out of the office. We're still in a remote work model, and although we have about maybe 350 seats in this administrative hub, really only about 10 or 15 of us are using it on any given day.
Well, that, I think, speaks to some wonderful organizations. So you went virtual back in March when we were all asked to stay home and stay safe?
Yeah.
How has, what is this, 9 months into this now, how has this COVID situation affected your operations?
Well, it's been a challenge, no question about it. I mean, the whole, initial phase of just trying to figure out what was going on and how to make sure we keep people safe and healthy, really consumed us. And then, we got in the business of taking care of people with COVID-19 and then also helping others that needed health care, kind of during this crisis. And it's been, challenging. I will say that the silver lining is that we're caring for more people today than we ever have in the history of our organization. So, with all the ups and downs and troubles, we are going strong, helping lots of people, and our teams have really stepped up.
And tell me what is different now, other than everybody's working virtually. That's sort of enough of a difference. But from a patient care standpoint, how have things changed with this introduction of COVID?
Well, I think so much has changed. I mean, for one, just the need for intense daily focus on employee health and safety, even more than ever before. So, just the overlay of protective equipment and protocols and screenings and employee testing have been really significant. And we feel good about it because our staff is staying safe, and we're not seeing them, be put in harm's way to the extent where they're getting high rates of infections. So, all the added activity in this area has been good because it's helped a lot of people, but it certainly adds to the complexity of people's day. And then, when certainly families and patients are stressed out, concerned about themselves not being put at risk. And at the same time, a lot of the people we care for are isolated and lonely. I mean, there have been, limitations on travel, and not everybody's been able to see their loved ones, and that's been an issue as well. So a lot of social stress, I would say, on the system. And, medically caring for the people with COVID-19 has also been a challenge for our teams, but we've developed some protocols that are working well.
That sounds good. And because you're a medical doctor, is your approach to infectious disease different, you think, than someone perhaps who didn't have your extensive background?
Well, I don't know. I think that this is quite a new challenge. I mean, it's something that in my medical career we hadn't confronted before. So I've got to say, I feel like I've been taken to school every day. I do think that once we started to see some of the science and evidence about the way this virus spreads and what can be done to slow it down, it's been very concerning to me, because it's just a real hard problem. I mean, this type of virus where it can spread from people when they're asymptomatic and impact some people very mildly, and then other people it'd be a fatal disease. This is one real challenging problem, I'd say. So I have been humbled by the challenge and concerned about it.
But it also sounds like, because of your opening statement with you're serving more people than ever before, it sounds like you've risen to the challenge and, as you said, put in place some protocols. Do you want to share some of the protocols and the things that have been put in place to keep your patients and staff safe?
Absolutely. And I think that's the most inspiring thing. And I think the most important thing to know is that, we can do it. We can grow and serve and not be afraid if we focus on putting in place the protections and the systems to keep going. If we take care of our people and our workforce, they'll do anything. And we have focused a lot on protective equipment. So home visits, all of them, of course, involve masking and gloves and hygiene protocols, also pre-screening patients and families to identify any risks that our staff might be going into a home where there's someone with the infection. When we have higher risk situations like, people coming out of facilities or people with known COVID-19 infection or other respiratory symptoms, those visits, also would include, respiratory precautions or special masks in addition to, the masks and eye protection that are being used on our standard visits. We're doing daily electronic screening of our teams, both the people going out in the field and people coming into the office, in terms of checking in regarding any symptoms or exposures they might be having. Lots of education of our teams around infection control processes, around identifying signs and symptoms of COVID-19. We have testing, so our employees all can get voluntary testing. If they want a test, they can get a test paid for by us. First dollar. There's no, we're not, charging the employees or making them go through the inconveniences of dealing with, the outside medical system to get tests. We get them tests, high quality PCR-based tests that use saliva samples, which is a little more comfortable than the nasopharyngeal swabs. We also, in addition to voluntary testing, we have a mandatory testing model that's doing samples of our staff. So people get picked on a random basis to get their tests done, just to surveil, just to make sure that we're not seeing any, hidden infections within our teams. So, those are some of the major measures. We also have a big program right now with respect to influenza vaccination for our workforce. Make sure everybody is up to date on their flu vaccine, so that we don't have a kind of a double whammy with COVID-19 and the flu this fall and winter. So those are the areas of focus.
Well, it certainly sounds like you have a good handle on this. And it seems to me, because your numbers are up, that what the trend you're seeing is something I'm seeing around the country, and that is that we'd always wanted people to trust home care, and it seems like now more people are trusting and referring to home care.
I think that's absolutely true. I think that we've really made our mark.
And how is this going to take us into the future? Do you think this increased usage of home care and trust from referral sources is going to continue?
I think so. I think the future is really bright for home care. Some of this, we have to be clear. It's a difficult subject, but some of the boost in home care has been because of some of the challenges and quite frankly, fears around facility-based services and infection control within facilities. There have been, outbreaks and even high levels of mortality in some types of healthcare facilities. And so I think, one of the things that's driven, people to turn to home care has been fear of, catching a coronavirus in a facility. And I think that fear, quite frankly, that issue will continue because this virus is so, transmissible until there are better, treatments and some type of vaccine. So I think that's driving some of this. I think, another issue has been the people that are at most risk for complications are older people with serious illness. We know their preferred way of getting care is at home and in the community. So, that's definitely been a reason why home care has received, more attention in all this. So, but I think, we've already been on an upswing anyhow with demographics and pressure on the hospitals and physicians to create more efficiency and value by treating people in the home and community. So I think this trend is going to be long lasting.
I have a geographic question for you because you're at your headquarters in New Jersey, but you also have a large operation in Ohio. And do you have other states as well, or is it just New Jersey and Ohio? New
Jersey, Ohio, and we have a program in Southeast Florida as well.
Oh, okay. So do you see geographic differences in people's response to accepting more home care and their comfort level with home care, or is it pretty much universal around the geographic spread that you serve?
I think the trend has been universal. Certainly, New Jersey had the experience of truly having overcrowded hospitals and many devastated nursing facilities, which we didn't see, and hopefully we won't, that extreme degree of overcrowding and stress on the facility-based system in other places. So I'd say that, there are differences, but overall, the general trend to, get people care at home seems to be across the board.
Well, you have a national perspective because of your long tenure in the care at home field as a physician, and also working with the National Association for Home Care, and now running your own operation. For how many years now have you been serving as CEO? Is it 10 years?
I've been the CEO for VNA Health Group for 8 years.
8 years.
Feels like 15 minutes, but it's I look in the mirror and I can tell that it's been longer.
So you've had this rich history, and what do you take from all of your experience, and how do we project home care in the future? Once the pandemic is gone, what can a consumer expect to find in the home care field that will be different than it was before the pandemic?
Well, I think that the resiliency of the teams has been shown, and the ability to be flexible and creative with technology, with using telehealth and virtual encounters in a more seamless way. I think it's hammered home for me. There's a lot of kind of technical people will say, oh, Dr. Landers, tell us about sort of the innovative thoughts about home care, or sort of how this fits in with modern medicine and everything. But truthfully, what it just keeps hammering home to me, what we've seen, is that it's all really about just people caring for people. And we've got to stay vigilant about that those caregivers, about the teams, really about the nurses and home health aides and other, frontline workers, and, making sure that they're protected and supported, but also, we got to fill this pipeline somehow. The thing that's going to cause us to run out of steam is if we don't have the workforce in place. And there are some signs of cracks. And so I think that is going to have to be where those of us, leading organizations or working on, national initiatives, we've got to really zero in on that piece, because, the demand is there, the public trust and interest is there. Policymakers seem to be more or less on board. I mean, they have their ups and downs, but the policy world is being supportive of home health care. And we got to make sure we've got the people and that they're supported and engaged.
And are we as an industry doing enough to make working in care at home an attractive profession?
I think that there are initiatives, so I wouldn't want to say that nothing's being done, but I think we're going to have to go a layer deeper and somehow impact even the education system more directly. Because, like nursing, for example, nursing's really crucial in all this. And the nursing schools, they're not graduating enough students to fill the vacancies in nursing. And if something doesn't change there, we're always going to be behind the eight ball.
That is interesting. I know there are some national organizations that are working to enhance education and benefits for people that are going into the healthcare field. So is there something specific about nursing that makes it more difficult to attract people?
Well, it's not the attraction issue, actually, Marilee. That's the interesting thing. The nursing schools, the stat I know is that last year turned away 75,000 qualified applicants. And the reason that they're turning them away is they don't have the capacity because of faculty shortages and clinical space. And you think about it, I mean, what could be better for our economy, for families, than for people to get these jobs in nursing? I mean, these are real anchor type of jobs for families. They're great, particularly for, women and minority-led families that really need that income. They're great careers, yet we're turning away qualified applicants because our nursing schools don't have the capacity. So something needs to give where the bottleneck is opened up, because we need the people.
That's interesting. I didn't realize it was an infrastructure issue. That's not one that I'd heard, and it sounds like I should have heard that. I
think it's not being talked about enough. That's why that's why anytime anybody talks to me about the future of home care, this is a topic that I bring up, because I'm concerned about not having enough nurses. Now, once we get nurses trained in nursing school, the other question is, how do you get them into home health and community-based care? And we actually have been rolling out a residency program that we've been experimenting with, where we provide special training to turn people on to home care and in community-based care. But first, you need the people, the nursing schools to produce enough graduates. The number I've got is that we're expecting right around 250,000 vacancies a year over the next decade for registered nurses across all types of healthcare settings, and that our schools are producing about 180,000.
Wow, that's a pretty big disparity there between need and that's amazing. I did not realize that. It sounds like this is something that, from a national level, that we should really be emphasizing and talking about more.
Yeah, I agree. And the one thing I wonder is, can we use more of all those rich home care clinical encounters to have more learners involved? Like today, there'll probably be, thousands and thousands. Even in my own agency, there's 3,000 home visits being done today on a typical day. Very few of them, if any, involve learners, involve students. So, the one thing I think we can figure out is, how can we contribute capacity to nursing education in some way that's mutually beneficial?
Wow, that is a wonderful thought, and also a great challenge for the future, because we do know that most people want to receive care at home, so they obviously have to have the people involved to support that care. So you've given me something to really think about in the future. Thank you for that. I am close to the end of my questions for you today, and is there anything that I have not asked you that you would like to talk about in closing?
No, thanks for the chance to connect. It's always a pleasure to speak with you, and I'm just thankful for all the work that you do to, keep people informed about, the latest trends and activity in the world of home-based care. It's, this is a team sport, within our companies, but also across the industry. And, I'm proud to get to connect with you in this way and work with all the other people out there on these important things.
Well, thank you so much for being our guest today. And I know you've always been an advocate for helping Choose Home. So let me know if there's any other way that we can be supportive.
You got it. Have a great day.
Thank you. Thank you so much for listening today, and a special thanks to our sponsors and partners, National Association for Home Care and Hospice, Access, and Core Cubed. If you've not done so already, please subscribe to our podcast and take the time to leave a review on Apple Podcast. We are now also on Spotify and most other places where you find podcasts. Like and follow us on social media, and join us. Want you to spread the word and help choose home when care is needed.